Good morning, everyone. I am Hee-jung Kim. I am very pleased and honored to give this presentation here today. The title of my presentation is A Phenomenological Study on the Exhaustion of Home Health Care Advanced Nurse Practitioner. This slide shows introduction. Community nursing care services in Korea are operated in three forms. There are first, community visiting nursing, second, long-term care insurance visiting nursing for the elderly, and the last, medical institutional operated home care nursing. These three types are home care services. However, home care advanced nurse practitioner in hospital need to provide patient care in special home environment, performing nursing therapeutic skills and solve patient problem alone without colleagues or medical staffs. So everything is different from the hospital situation. Therefore, a variety of ability of home health care nurse practitioner are required because the home health care advanced nurse practitioner themselves are required to perform and be responsible for their work. Therefore, home health care advanced nurse practitioners have conflicts or burdens because their home entirely dependent on individual qualities. When problems arise, it was also reported that the level of work stress for home health care advanced nurse practitioner was very high. And the study found that the cause of high work stress was high levels of exhaustion experienced by nurses. The purpose of this study is as follows. In order to deeply explore the meaning of burnout experienced by home health care advanced nurse practitioners when they work at home, Cloaz's phenomenological research method is applied to in-depth study of the meaning of burnout. This study is phenomenology study. Phenomenology is the study of the phenomena and appearance of things, and the ultimate purpose of research is to discover their essence. So this study is qualitative study in which Cloaz's phenomenological research method is applied to comprehensively and in-depth understanding of the meaning of burnout experience of home health care advanced nurse practitioner. In the data analysis of this study, Cloaz's phenomenological method 6-step was applied to find a clear meaning in the contents described by the participant and to accurately state the essence of the phenomenon. The analysis process of the study is as follows. First step, during the interview, using the recording function of the researcher's LG-V50 ThinQ cell phone device, the researcher's permission was obtained and the recording was recorded. Hearing the recorded material and transcribed, the subject's protocol were read repeatedly to understand the overall feeling. Second step, among the transcripts, repeated statements of participant and significant statements related to exhaustion were underlined and derived. Step 3, general restatements of the underlined statements. Step 4, formulated meaning was derived by trying common meanings from the statements. Step 5, the derived meanings were organized into categories, themes, theme clusters. Finally, sixth step, a clear and complete exhaustive description was made by integrating in relation to exhaustion. After going through these 6 steps, the researcher reviewed the data after visiting 2 of the participants to confirm the validity of the essential structure of the experiences. This slide shows result. As a result of analyzing a burnout experience of 6 home health care advanced nurse practitioners, a total of 86 key statements were extracted. Among the statements, these that were judged to have overlapping or similar meaning were collected and reduced in number. The meanings contained in the passages of the main statements were deeply explored and 50 constituent meanings were derived. By categorizing 50 constructive meanings, 13 themes that can contain comprehensive contents were finally derived, and the 13 themes were organized into 6 thematic collections that can be combined abstractly and interactively. The constructed meaning was derived from the meaningful statements of the participants, and 3 categories were derived as a result of categorization by checking the theme and theme cluster in the formulated meaning. The 3 derived categories were identified as toughness of home care, the responsibility and burden felt as a professional, and the last, the driving force for overcoming exhaustion. This slide showed 3 categories, theme cluster and themes as like table 1. 3 category, toughness of home care, responsibility and burdens felt as a professional, the driving force of overcoming exhaustion. This study is a qualitative study in which data were collected and analyzed by phenomenological method to reveal the structure and meaning of related phenomena by in-depth exploration of the burnout experience of professional family nurses, that is, home health care advanced nurse practitioner. The result derived from this study: first, it is toughness of home care; second, responsibility and burdens felt as professionals; third, the driving force of overcoming exhaustion; and finally, overcoming exhaustion by influencing the power and value of home health care advanced nurse practitioner, personal resources and activities with positive feedback. Since this study targeted home care nurses and home health care advanced nurse practitioners working at general hospitals and senior general hospitals, it is difficult to expand the research results to home care nurses or home health care advanced nurse practitioner belonging to small hospitals. Thank you so much.